And so today I'm going to tell you a bit more just about the research I've been doing on obesity and child food choice, and share with you some of the challenges we've had that are quite similar to some of the work you do, many people do in developing countries, and talk about the role of incentives in these types of settings, and then discuss the paper When Incentives Backfire, the Spillover Effects in Food Choice. So obesity is a major public health concern globally. It leads to many chronic health conditions. The major components of this problem are habitual consumption of high quantities of low nutrient and high calorie foods, and that individuals are more likely to eat familiar foods where the tendency to consume an unhealthy diet is learned at an early age, which is why interventions with children can be quite important. Now, these habits are learned in the home, and it's very difficult to intervene in the home, and this can lead to cycles of unhealthy behaviors. So we need to address decision-making about food choice by children and adolescents, also because lack of proper nourishment can affect functioning in school, not only in developing contexts, but also in the US. And in the US, we see that 17% of the nation's youth had BMI that were quite high. This is from 98, it's gone up actually since then. And children from low-income families are at higher risk. So all that to say is that we think of the school lunchroom as a teachable moment for running interventions to improve food choice. It's hard to intervene with children in the home, but it's quite easy to intervene with them at school. And children are consuming food at school on a regular basis. And importantly, some of these USDA-sponsored programs like school lunch, school breakfast, and after-school programs are aimed at low-income children. So in the districts, school districts where we work, often every single child is receiving the USDA-sponsored school lunch, and we can have interventions on that program. And this is actually a photo of one of my research assistants, Katie, who's dressed as a cafeteria worker and implementing one of the interventions that I'll share with you today on milk choice. So one of the biggest ways that behavioral economics has made inroads in public health has been through using incentives, as many of the studies from this morning have shown. We've seen that agents value even small incentives to shift their behaviors as related to weight loss, smoking cessation, medication adherence, and so forth. And they are also a way to encourage healthier food choices. So one example of this, with my colleague John List at the University of Chicago, we had an experiment field study with about 1,500 children where we gave them choices between cookies or fruit in an after-school lunch program. And basically had this choice, and then we told them that for every time you choose the fruit and you eat it, you get to have one of these awesome gifts. And so we have these pens, we have little keychains and trophies and little rubber ducks. So these are very cheap incentives that we can use. And we actually found that in the control group, only about 17% of children were choosing the healthier fruit snack. And in the treatment group, once we introduced the incentive, that went up to 75%. Children who choose and consume the healthy snack. So these incentives were very effective at improving these kids' food choices in this very small context. And we ran this over several days, and we see these incentives persist to continue to be effective, and the trophy is the most popular of all of these items. So let's see. So we have another follow-up there in the school lunchroom. This is from the picture with Katie behind the milk. Kids can choose between white milk and chocolate milk. Chocolate milk has much more sugar content than white milk, yet most children are selecting the chocolate milk. So school officials, as well as us, want to try to encourage kids to reduce their sugar intake by selecting white milk. And one way we did that is we had a treatment group in which we just added a small glow-in-the-dark bracelet to the milk carton, the white milk carton, and not the chocolate. So if you got the white milk carton, you got to keep the little glow-in-the-dark bracelet. And we use the glow-in-the-dark bracelet because it stops working after about 24 hours, so we can continue using it every day, and you got to replenish your bracelet. And this proved to be a very popular toy. And we increased the white milk selection from about 16% in the control group to about 40% in the treatment group, with no change to consumption. What I mean by that is you still drank the same proportion of milk, whether you chose chocolate or white milk. So these incentives are quite powerful. And there's two other papers that have looked at incentives in school lunchrooms. One is by Justin Price, and they find that these small monetary incentives affected the likelihood of choosing an additional fresh fruit or vegetable side item. And another by Michelle Below and co-authors, where they show that these incentives also increase the healthfulness of the lunchroom choices in the UK. So in addition, we have another project with John List and also Terry Zhu in a small format grocery store in a low-income area of Chicago. We try out incentives with adults, and here we are giving $1 incentive for purchasing at least 5 cups of fruits and vegetables. And at baseline, we have about 200 participants, and we track their behavior for 8 months. And at baseline, the control group on each shopping trip is purchasing only about 0.3 cups of produce, so not very much at all. And once we give them an incentive, it goes up to about 1.6 to 2.2 cups of produce. So there again, we see these incentives having very big effects. So all of this to say, we have all of these studies of incentives. This is not a really behavioral finding. This is standard economics. Incentives increase the take-up. What we now want to turn around and ask is, do incentives always work? And so we believe that incentives may actually backfire in some instances because they work both as prices and as signals. So the price effect is where I give you an incentive, it increases the benefits of take-up of the healthy action, and then that increases the healthy action. The signal is I have more information than you do about taking up this action or the difficulty in taking it up, and therefore I want to pay you to take it up, and maybe that's a signal to you that that's not something you want to do. So in the case of the fruit versus the cookie choice, a lot of the kids in these low-income areas of Chicago don't necessarily have a lot of experience eating fruit, and when I say, if you eat the fruit, I'm also going to give you this awesome trophy for your good deed here of eating this fruit, that might act as a signal to me that I actually maybe shouldn't eat the fruit, maybe it's really gross. And so that's the way that these signals might work. And there's some literature on this showing that incentives can signal that the task is difficult or that the quality of the incentivized good is poor, and that's why I don't want to take it up. And there's some other evidence showing that incentives that are too small might also decrease intrinsic motivation. And these are all direct effects. So these are all the effects of an incentive when I am incentivized, when I'm the agent being incentivized. One limitation in this literature is that it has not considered the spillover effects of peers. So what I mean by a spillover effect is suppose I see that many people around are incentivized, and that might make me also derive a signal from this incentive. So the whole room is incentivized to choose grapes. Now I think maybe grapes are really, really bad because I see all of these people that are getting paid to eat grapes. And so this is our example here. So consider you're paying students to choose the healthy snack at school. And we do our payments through little toys because this is what the school is fine with and this is what kids value. And the direct effect of that incentive program should increase the take-up of the healthy snack. And indeed it does in some of these earlier studies that I told you about. We see these big increases from 20% of kids choosing the healthy to 80% choosing healthy just by offering these little trophies. And what about when we incorporate peers? So much of the work that I had done to date had been just individually. We go to the kids and we ask them to make a choice and we give them these incentives, but now what if I see the peers around me are also getting incentives and I see the types of choices that they're making? Now we could see spillover effects. So observing peers' actions. So first, if I see my friends picking a healthy snack, but maybe I don't know that they got an incentive for it, I might think the snack is also delicious and I might also decide to take up the snack. And there's another type of spillover effect, which is observing peers' incentives, which could have a negative effect. So if I see my friends are choosing the healthy snack because they got an incentive to do so, that might act as my signal of bad news, that snack might be low quality. And the magnitude of these effects might vary with the proportion of children incentivized. So in our paper now, what we did is we conducted a field experiment in a school lunchroom in this low-income area of Chicago that lets us measure the overall effect of incentives and decompose it into the direct effect and these spillover effects that I told you about. So we had 1,600 children in grades K through 8 in a low-income Chicago neighborhood. This is Chicago Heights, Illinois. It's south of Chicago. And there's 9 elementary schools there. And about 80% of our kids are on free lunch, and even more are on reduced lunch. So this means that they're at that poverty line that the USDA believes should be reimbursed for their lunches. So all of these kids in these schools are actually getting all of the same meal. And we're at 9 different elementary schools. So we ran this as an artifactual field experiment, meaning that We ran it as a game. So we have kids who are offered the choice of grapes or a cookie at the lunch table. This is after they've gone through and picked up their main lunch. And we're going to vary the proportion of children at the lunch table who are incentivized to choose grapes. And we're going to allow children to change their mind after observing their friends choose. And we're going to vary whether the incentive is private or public information. And through all of these different things, we are going to determine the spillover and the direct effects of incentives. So we conduct the experiment after children collect their lunch trays and sit down at their table as they normally do. Most kids get to sit at whatever table they'd like within their school lunch period. They're often sitting with their same grade, their same classroom with their friends. And they're typically sitting in groups of about 3 to 10 per table. And they're getting the same school-provided lunch. So they don't have choices there. Now, we don't randomize who sits where, so they just sit where they'd like to sit. And I think that's fine because here we're trying to maximize these, trying to give these spillover effects a chance, and they might be more likely if I know the people I'm sitting with. The experiment's implemented at the table level, so I sent out several research assistants to each school at once, and they implemented adjacent tables at the same time. So we randomize different tables to different treatments, but we don't allow kids to observe what the other treatment is doing because we have one RA per table. So we have cards. We have cookie cards and we have grape cards. And cookie cards are one color and grape cards are another color. And from a card deck, and each child is going to select a cookie card and a grape card. And they're going to get to choose an additional dessert, either cookies or grapes, by placing that card that they prefer down on the table. So they play the card of the dessert that they like, and then as soon as everybody is done, the RA comes back around and hands out all of the desserts. So we have 2 stages here. In the stage 1, there's a simultaneous selection of desserts. So everybody collects their cards, they play the card that they would like, and then we give them about 20 seconds, and then we surprise them by saying, now you can look around the table and see what other people have chosen, and you can change your mind if you want by changing your card. So this is stage 2. And we can look at the results after stage 1, because we record their initial choices, and after stage 2, because we record their final choices. This is what the cards look like. So the cookie cards are blue, and then there's 2 types of grape cards. So there's the grape card that just has grapes on it, and the grape card that also has a token. And every single child in all of the treatments is told that if they end up choosing a card with a token on it and they play that card, then they also get a gold token, which they can either keep or exchange for a couple of other different toys, similar to the ones that I showed you before. And they can't choose a grape or a grape plus token. They just pick it from a deck. So I get this cookie card, I get this grape card. Different decks had different numbers of each kind of card. So we had decks that were 100% these grapes without incentives. So we had tables in which grapes were not incentivized. And we had decks with 100% grapes plus token. So we had tables where every child was incentivized. And finally, we had decks with 50% grape cards and 50% grape plus token cards. So there, depending on the random draw, somewhere between 11 and 80% of kids at a table were actually incentivized. So we randomized the proportion of kids incentivized at the table by simply randomizing what the cards look like inside of that deck. So whether or not the child is incentivized is therefore randomly determined because they can't see what cards they pull from the grape deck. The proportion of children incentivized at the table is randomly determined. And finally, we have a public and a private treatment. So in all treatments, I know whether my friends are choosing grapes or cookies. But in the public treatment, you play the cards face up. So I can also see whether there's a gold token on your grape card. And in the private treatment, I play my cards face down. So I can see whether I'm playing that blue cookie card or the green grape card. But I don't know whether that card is incentivized. So that should answer your question about the private versus public. So it's public in the sense that I always know what everybody's choosing, but the private part comes in where I don't know whether the kids are incentivized or not. And that's because we believe spillovers could act through this channel of just simply observing what other kids are choosing might change my behavior, but also observing incentives might change my behavior. Yes?
Can they see the grapes before they play? Because, I mean, a cookie is like a relatively homogeneous good, but grapes
No, we show them a picture of them, but we don't reveal them, which I think cookies also don't have a lot of homogeneity, because there could be good cookies, there could be bad cookies. Our cookies might be on the bad side because we have to comply with some sugar content regulations when we run this. So it's not an entirely awesome cookie. It's like a little bit, ends up being a little bit healthy. But I think we want to do that for a reason, because we think these signals work better when there's some uncertainty about the good involved. So if we show them and let them touch it and things like this, that might affect the effect of these signals. And here we try to give signals a chance to work.
And did you do anything to ensure the private treatment remained private?
So we told them not to show their cards to anyone. We had one RA, and there was an average of 5 kids at the table. I didn't see from any of the reports I had from my RAs that the kids were trying to cheat that, and there's no real reason for them to, because they didn't get anything from showing their cards to others. Does that answer?
Okay.
Yeah, okay. Yes?
So even though you have these public-private treatments, are all the children aware that someone could be incentivized?
Yes, so when we shared these cards with them, we told them about all 3 types of cards. So we told them, this is the cookie card everyone's going to get, but the grape card could be this one or this one. So they always know incentives are involved. All right, so this is our summary of treatments at the end. We have about 1,700 kids who ultimately participate. We have this private versus public, and then we have the variation in the proportion of kids that are incentivized, the number of tables, and also the number of subjects. And we put more of the subjects in the 50% incentive condition, because that's the one where we end up having variation in the proportion that are actually incentivized. All right, so I will just share with you the summary of our results. So first of all, similar to all of my other research and that of colleagues on the impact of incentives on food choice, if I receive an incentive, I'm going to increase my likelihood of selecting grapes versus cookies from about 50% of kids choosing grapes to about 75% of kids choosing grapes. That's our direct effect. Yes?
Sorry, remind me, the first choice they made, they didn't know it would be revealed to others, right? That was a surprise to them.
They didn't know they could change their mind.
But they did know that other people would see what they had chosen.
Yes, yes. And in the public treatment, they would also see whether they got an incentive, and in the private treatment, they wouldn't see whether they got an incentive. And if they got an incentive, they went with their card at the end of the lunch to a different area, and they got to pick a toy.
Because that seems high, 50% relative to your...
It does, yes. And so it turns out that in some of my other work, like the white milk, it turns out people really don't like white milk. With the dried fruit, these kids didn't really like dried fruit in this other study with dried fruit versus cookies, and we had to use dried fruit for a number of refrigeration reasons. In this study, we were excited to use fresh fruit, and the cafeteria workers were excited to use fresh fruit, and we ordered fresh fruit in bulk at the University of Chicago and stored it in these big fridges in every single break room, and then we busted over to Chicago Heights. It was very complicated, and it turned out kids really liked the fresh fruit better, so that's good, but it makes a smaller treatment effect. We go from 50 to 75%. So about 5% of kids are revising their snack choice when they observe the snack choices of others. So that indicates that there is some spillover effect. So we see what other kids are doing and I change my mind. And that varies by treatment in different ways. And then the total effect of our incentives, so combining the direct with the spillover, varies by the proportion incentivized and also by the public and private treatment, which suggests that there is some signaling going on, and in particular some signaling from peers that's affecting the decision-making of kids. So this is one of my main slides. So this is a figure plotting the total effect of table proportion incentivized on a variable indicating the initial choice of grapes. So what this figure is telling you is on the x-axis I have the proportion of children who are incentivized, and on the y-axis I have the initial choice of grapes. So this is before I see what anyone else has done. And the blue line is my public treatment, and the red line is my private treatment. And we could see quite clearly that as we increase the proportion of kids incentivized, the overall number of grapes picked at each table increases, which is what we would expect considering that incentives improve grape take-up. So this is the initial effect. Next, we're going to look at the final effect, and this is after we give spillovers a chance to work. So this is what our final effect looks like in the second stage choice. Now what's interesting here is that we see the same increase in the proportion of kids choosing grapes until we get to about 2/3 of kids being incentivized, at which point the public treatment actually drops below and significantly below the private treatment. So essentially once we incentivize everyone, we actually see a decrease in the likelihood of final selection of grapes relative to a private treatment, suggesting that this spillover effect of observing that everyone is incentivized does convey some kind of bad news about the grapes that decreases my grape take-up. And there's a number of regression results in the paper that kind of corroborate these results and look at it at the table level versus at the person level, but essentially this effect continues to hold, which is that the total effect of incentives once they are public and 100% of kids are incentivized is significantly less grape take-up than in the case where it's private and everybody's incentivized. So in private, the proportion of choosing grapes increases with increased incentive and probability, but in public, it increases but begins to decrease once there are many, many incentives. Now, this is important for a lot of reasons. So we see these direct effects of incentives being quite large. In a lot of related work, the impact of peers or the impact of the proportion of people incentivized is ignored. And here we see that these spillover effects are also quite large, especially this negative effect of observing other people's incentivized choices. And when the peer effects are visible, the positive effect of seeing peers choose grapes is more than offset by the negative effect of seeing peers incentivized to pick grapes. So then this overall effect of incentives, once we combine this direct and spillover, is positive when 1/2 or 2/3 of children are incentivized, but declines beyond that, so that for the 100% group, it's not statistically different than the 0% incentivized group. Now that's a quite interesting result and has many implications. One, which we believe this is initial evidence for the fact that peers and spillover should not be ignored. So many studies have overlooked the possibility of these kinds of effects. Now we're not saying that as soon as you incentivize more than 2/3, you'll see a drop. That might just be in our setting. But our setting is one example of a case where these negative spillover effects might happen. And in a practical sense, it may then be preferable to make incentives private knowledge rather than public knowledge whenever that's possible. It might not be feasible in many settings where I know my friends are also getting incentives for a certain action. And spillover effects might be quite large in environments where the value of the incentivized action is not well known. So adoption of new technologies or new behaviors where I don't have much information about the immediate benefits or costs of such a behavior relative to the principle that's assigning these incentives to me. And overall, more broadly, separately measuring spillover effects using this kind of two-stage design and varying the fraction treated could be quite important to see how experimental results might scale up when introduced more broadly, because often when experiments are run in the field, a small subsample of people are actually receiving an incentive versus not, and the idea would be that once you actually introduce this as a policy, you would be incentivizing a larger proportion of the population. Yes, so we don't have a continuous, like what you said, of probabilities, and there is not much at that one, so that spike that you see is probably not so spiky if we had added more data. Yeah. So we include age as controls, and I don't, and my co-author actually has done most of the analysis for the detailed analysis, and I don't recall now what we have for age, but we pool the data, I think, because we don't see much differences by age. So the receipt of the token is private because it happens at the end. You take your card, and after you leave lunch, before you go back to the classroom, you go and you can redeem your incentive, and you can always put it in your pocket because they're really small. This question about fairness is a good one. So we actually, if we thought that the fairness was what was driving the result, we would see that at the 80 and 90% incentive, where I'm the only kid unincentivized but everyone else is, that might result in negative, but we actually see that the 100% incentive. So everybody's incentivized, and yet still we see this spillover result. So in the paper, we also separately look at the table size. So most table sizes are not size 3 and 10. So if we drop those outlying tables, we then can analyze the data and find similar results to what we find when we expand the sample to the larger or smaller tables. So we've tried to do some of that in the very first study I mentioned. So we follow kids. We offer this choice twice a week, and we do this over a series of, I think it's 4 weeks, and then we track behavior also after the intervention. And we see some evidence of habits forming, like kids are starting to be more likely to choose the fruit over the cookie, but it drops quite considerably. And with our adult population, we see this as well. So we track people for 6 months where we offer $1 for choosing at least 5 cups of fruits and vegetables, and we track them for 2 more months where we don't offer the conditional incentive, and we see people are more likely to still be purchasing fruits and vegetables in the 2 months after, but there's a decline. So at the least what we can say is incentives aren't causing a negative effect, which is one worry that this incentive literature has, which is that I incentivize you, this incentive conveys some kind of bad news, and then as soon as I remove the incentive, now you decrease your intrinsic motivation to eat healthy at all and stop eating healthy at all. We don't see that, so we can definitely rule that out, and we see some evidence that habits form, but it's hard to sustain these habits, I think. And a lot of the research has been over short periods of time. And part of the reason our research is over short periods of time is the school can only tolerate us for so long. And then they make us leave because they have standardized testing or something else that needs to happen. Right, so I think there's always a trade-off between running something that's more lab-like, where you have more control, over running something that's in the field where you have maybe less control, but it's more natural. And in this case, we went for the former because this is one of the first studies at all to look at the spillover effects of peers. And I see this as more as a first step to show that this is something that we should care about, and I think future work should be looking at this in a more natural environment. When we talk about these peer spillover effects, also in our paper, we talk about them having potentially negative effects, like what we find, but also potentially positive effects. So the more, if you believe that the incentive is good news rather than bad news, then seeing more of my peers incentivized suggests that the spillovers would be positive. That's right. So I think considering spillover effects generally is quite important. In many contexts, they may also have positive effect. So that, I think, goes back to the earlier question about fairness. And what's interesting, and that's something I would have thought too, but what's interesting is that it's in the 100% treatment where 100% of kids can get an incentive for grapes, where we still see a decrease between public and private. So the other thing we also look at, actually, we map all the friend networks. Is what we were really interested in is seeing whether these spillover effects matter based on how many of your best friends are sitting at your table and so forth, and we don't see much. So it doesn't seem to be the case that I have solidarity with friends more than with neighbors. It just seems to be more about visibility of an incentive or not. And I think I'm between everyone and lunch, but I don't know what time it is. And so I encourage you to choose the grapes and not the cookie. And there are no incentives provided.